selected chronic disease problem statement. We have the root causes that we identified, as well as the CHIP action plan starting point you all voted on during last month's meeting. And I think that this will be especially helpful for anyone who's just joining us for the first time today or who may have missed last month. We just want to make sure, again, that we're all just starting from a shared understanding because we get to go into drafting some goals today. So we're moving right along in this process. So as a reminder, the problem statement that was selected by our CHIP steering committee highlights that preventive care utilization remains low, which is leading to late-stage diagnoses of chronic disease as well as preventable hospitalizations. And our data that we pulled from the community health assessment also emphasizes the need for early screening, maintenance programs, and resources in the built environment to provide better comprehensive primary, secondary, and tertiary prevention of chronic disease. Now, if you remember back in November, we did use the 5 whys approach to really just try to dig deeper into what's driving these trends. And we learned that low preventive care utilization is not simply a matter of just personal choice. It actually can reflect some upstream barriers. So we talked about things like limited access to primary care, as well as longer wait times. We talked about some logistical barriers like transportation, scheduling issues, location, which I think reflects, more broader infrastructure and even some income inequities that exist. We talked about limited culturally responsive care, as well as some medical mistrust, I think, which are, we talked about how those are rooted in gaps in representation and even some training as well. And then there's just, those historical harms and ongoing inequities. We talked about insurance gaps, high out-of-pocket costs, as well as health systems that tend to prioritize treatment over prevention, which in that conversation, we talked about how that might be influenced in part by provider work schedules, even some of their practices, as well as some broader economic pressures. But last month, we used those root causes to determine where we wanted our action planning brainstorming to begin. And so if you remember, we polled the group last month, and about 35% of the group voted to focus our efforts on the built environment and healthy living supports. So things like strengthening access to healthy foods, safe physical activity, as well as some prevention supportive environments. And I do also want to note that these votes were pretty close. I think we had 21% of the group also, for each category, also voted to prioritize prevention and early detection, access to primary and preventive care, as well as system navigation and care continuity. So I think this is just reflective of the idea that, we do recognize there might be some overlap in some of these starting points. And we also recognize that, even though we're starting with the built environment and healthy living supports, our broader goal and our strategies, I think, will just naturally incorporate some of these elements from some of the other starting points as well. And that's okay, right? If you remember, we also acknowledge that there are also many ways that we can address this problem statement, but rather than trying to tackle everything at once, we wanted to commit to identifying a strong starting point, something that we agreed felt kind of urgent, something that felt feasible, and something that might even align with some of the current efforts in the county as well. So quality over quantity. And again, the idea is that, we begin broadly and then slowly narrow our focus towards more actionable and equity-centered CHIP strategies to see what success could look like over the next 3 years. And we're actually going to explore that a little bit today. So here's where we are today. We have our problem statement. We explored root causes of the problem. We identified a starting point, and now it's time to streamline even further to set an overall goal for our approach. And to do that, we're going to use a divergent thinking activity. And for anyone unfamiliar with divergent thinking, it's simply really just a structured way to generate a lot of ideas very quickly. So, we want to explore various possibilities, even some unexpected ones, before we really narrow down and make a decision. So again, we're opening the lens first and then narrowing in later. So we're going to start with something simple. And my question to you is, what are all the possible uses for this fork? When we see a fork, what are the different ways we can use the fork? And it can be something very obvious, it can be something creative, and you can use the chat, you can unmute yourself to speak. But what are all the possible uses for this fork? Yes, I see eating spaghetti, combing your mermaid hair. Yes, my fellow Little Mermaid fan. Miss Linda says to eat with. Okay, yeah. Protection. I like that, Miss Priscilla. Yes, protection. Carrie says jewelry. Oh, I never thought to use a fork for jewelry. Okay. Lisa, an opener. Jennifer says to make art. Awesome, awesome. Any other possible uses? I'm giving another 10 seconds or so. To open a door. Yeah. To pry something open, maybe. I love that. Yeah, so notice what happened, right? We moved, excuse me, we moved beyond the intended use or the more obvious use of a fork, right, to eat with, and we started thinking outside of the box. So some ideas were practical, some might have been a little silly, and some were surprisingly useful. As Joyce says, to paint. Yeah, we have some art folk in here that want to use their fork to make art, right? And that's essentially divergent thinking, right? We're generating as many possibilities as we can before we narrow in. And I think this helps us see options that we typically might otherwise miss. And so we want to use this kind of thinking and apply the same thinking to our goal, but with a little bit of a twist. So what I need everyone to do is just use your imagination. And I want you all to imagine that there is a bowl of pasta in the middle of this room, right? Well, we're in a virtual room, but if we were all together in one room, there was a table and a bowl of pasta, right? And everyone in here has a fork. Now, some people might hold or use their fork differently. For example, some of us may want to twirl the pasta. Some of us may want to cut the pasta with our fork. Some might just scoop it all up and take a bite, maybe depending on how hungry you are. And some of us may decide not to use the fork at all. Maybe we're just handsy people. But if everyone acts independently, we're all going to try to use our fork with the same goal in mind, and that's to eat the pasta, right? And so that's duplication. But what if we took a moment and we paused and we coordinated with one another and we talked it out a little bit? And so, for example, instead of all of us just trying to bum rush this bowl of pasta in the middle of the room, what if we coordinated and said, hey, Lisa, why don't you gather some more ingredients? Miss Priscilla, why don't you prepare and season the food? AJ, why don't you grab us another serving bowl? Deborah, hey, can you help us set the table? And maybe Joyce can help us kind of portion out the pasta evenly for each plate. Right? So now everyone is contributing in some way. And now not only does our meal have flavor, because who doesn't want their food to taste good, but there's also a space at the table for everyone, and there's more food to go around to ensure that everybody has something to eat. And so this meal works because our effort is more coordinated. So even if everyone contributes differently, we're all still working towards the same shared outcome. Yes, Miss Priscilla, you're right, and it gets done sooner, right? Work smart, not hard. So our coalition work is very similar. We all hold forks. Some of our forks might be programs, some might be outreach, some might be services, expertise, knowledge, experience. But if we're all operating in isolation, we're competing for the same pasta or the same goal. But if we coordinate, we create a full meal, we feed more people, and we can be a greater benefit to ourselves and to our community. And so our coordination is what is going to make this collective impact stronger. And so this brings us to our goal setting, right? So when we draft goals, typically what happens is people jump straight into solutions or they talk about programs that exist. And that's kind of like us only thinking about eating the pasta with the fork. If we took a moment to do some divergence thinking, it allows us to step back, it allows us to brainstorm. We could ask ourselves questions like, what does success look like if we were to approach this problem this way? Who benefits from this approach? How do they benefit from this approach? What are some new, bold, or creative possibilities we haven't considered yet? Right? What might we be missing if we stick to what's familiar? So by thinking broadly first, we give ourselves more options to, or more opportunity to design goals that are maybe a little bit more ambitious, might be a little more inclusive, or even a little more innovative. And so before solutions, we need to get some clarity on our destination, on where we're trying to go. And so that brings us to our core question today. So when we think about the problem statement, when we think about the data and the starting point, and thank you, AJ, for putting that in the chat for reference, I ask you all to consider, what would success look like 3 years from now? You know, our CHIP is a 3-year document, is a 3-year plan. So what would that success look like for individuals, for families, for the community, with all of those things in mind? We know that access to programs and access to resources isn't just about availability, it's also about understanding. So what would success look like with this consideration? And so what I'm going to do is I'm actually going to open up our brainstorming whiteboard, and I'm going to pose this question to you all. Again, we have our problem statement, data, starting point, and root causes here for reference. But we want to consider, what would success look like for individuals, families, and the community? And feel free to unmute yourselves. You can type in the chat, and AJ is going to kind of help us plot some of this information down as a visual so we can work together to formulate our draft goals for today. I'll open the floor. What would success look like 3 years from now?
Here, I can start. Hey, well, I'm looking really at the root causes, and the very first one is like already limited access to primary care and long wait times. So I think increase access. I know that's kind of a generic term, but I really do think that there's a need for increased access, whether that is increasing the number of primary care options or if it is about long wait times, is it possible for us to, even if we can increase the number of primary care providers, can we increase the hours of the day where they operate, right? Because I think one of those issues is if we're talking from like a 9 to 5 workday, a lot of that is not that's not an opportunity. A lot of people who work all day, and they can't get, and the first thing that they're going to do is they're going to bypass a primary care appointment. They're not going to skip work for that. So maybe if we can increase access by increasing hours, whether it's early morning, more weekend hours, evening hours, in order to get people in the appointments. And that, I'm not saying that's going to make people go, but that actually create more access and more opportunity for people to do that as well.
Yeah, that's great feedback. And
Mhm.
you're absolutely right. It is hard to go to the doctors when they're only open during work hours and you have to work. A lot of times, community members or clients can't afford to take a day off of work because maybe they don't have enough PTO or they really just can't financially afford it. They can't find childcare, whatever it might be, to get to the doctor. So having extended work hours is a great idea. And there's a couple of comments in the chat. Ms. Priscilla said a well-blended community. I don't know if you want to expand on that, Ms. Priscilla, but you're welcome to. And Jessica says earlier, detection. Taylor, security in regards to the social determinants of health, so financial, transportation, and food security. Absolutely. Do either of you care to expand a little bit? Taylor, when you're referring to security, do you mean just ensuring that people have greater access to transportation or greater access to food? Is that what you're referring to, or something else?
Yeah, I think as public health professionals, we always think about the social determinants of health in terms of insecurity. Like I always think of when I talk about like food, I always think of like food insecurity or nutrition insecurity. I don't think about, being in a state of security. So I think this shift of being secure in terms of the social determinants of health. So you're exactly right there, Shanae, in terms of accessibility and availability.
I love that. I think that's a great point that it's important to reframe our thinking so we're not always thinking in the realm of lack. Um, so I love that perspective, Taylor. Thank you for sharing that. It's beautiful. And Priscilla is expanding on her thought on the well-blended community. So she says, not just, excuse me, not just a community of Latinos, African Americans, Caucasians, but a community blended together in nationality that supports one another instead of fighting and challenging. Right? So coming together despite our differences, right? I love that. Equitable access to everything, regardless of who you are. I love that. Any other thoughts? What would improvement in these areas look like in real life? Hey, Carrie. Carrie says more opportunities for the larger community to engage with healthcare leaders or services to encourage trust. I like that. Can you expand a little bit more on that, Carrie? Like, what would those opportunities look like to you in the perfect world?
Sure. I'm just thinking about like more um engagement with folks like that are on this call or are running health organizations or have services that reach a broader like economic community or levels at like health fairs or just like less pressured situations to engage with the people that you might need in the future of your health. I'm not saying that very well. I don't know. I just feel like when you are not doing well or you need a specific service in terms of um, healthcare and things like that, that's always harder to focus and not um, yeah, I'd rather just know what are the resources, who are the people before I need them, and put faces to names and know my healthcare community. I guess that's it. I don't know. That wasn't very clear. I'm sorry.
No, I think I'm tracking. I think that's great. Yeah, who exists in the community? Who's here? Um, what services already exist? What resources already exist? And it helps to know what those are before you need them. So that way, when you do need them, or if you do need them, or you know somebody who might need them, you um, can kind of already know where to go for that help or how to access that information. Is that similar to kind of what you're saying, Carrie?
Yeah, and like just removing the barriers to services, no
Mm,
matter what your means are and things like that. Yeah.
love it. Thank you. Appreciate that. Joyce, better coordination between clinics, hospitals, and community partners, um, and a real system to follow across different regions. I agree. Yeah, that's a good one. Thanks, Joyce. And AJ, more community events with local health organizations providing resources on supports and services. Okay. So AJ, in that sense, do you mean um like if we know of a community health event, having our partners come to those and maybe table those events or serve as vendors to kind of share what resources and supports they offer? I don't know if you hear me, AJ.
Oh yes, no, I said exactly. Yeah, exactly what you
Oh,
said.
perfect.
Yeah.
Perfect. Okay. Jessica, lower healthcare costs for patients and healthcare organizations. Great. Do you want to expand on that at all, Jessica? Okay, yep. Earlier detection hopefully lead to less use of more costly interventions. Absolutely. I had a feeling that's where you were going, but I just wanted to confirm. Awesome. Thank you for your contribution, Jessica. Yeah, these are all really great ideas. And I think if we were to be successful, I think these would be wonderful changes to see in the community. It definitely makes me think, in keeping the equity lens in mind, who would experience these changes first, who might not experience some of these changes, or what barriers exist to seeing these changes. So we definitely want to keep equity in mind as we continue to brainstorm. But when you look at these orange Post-its and some of the comments that were shared, what are some of the common themes that you're seeing? And again, you can use the chat or unmute. What are some of the common themes that you're seeing with these statements? I see community engagement.
Hi, this is Dr. Doolin. Can you hear me?
Yes, I can. Hi, Doc. How are you?
I'm doing fine. I've sort of been in and out of the room, but I heard you talking about some things that are in these what's 369 blocks.
Yes, sir.
And one of the things that we have been emphasizing here in the Office of Veteran Affairs is the fact that early detection is not getting really to the target group that they're intended to get to. And when I say that, I know that recently it's been put out that colorectal cancer is the number one cancer cause of death for really people under 50 or so. And they're encouraging everyone 45 and over to be checked for colorectal cancer. However, it's still very high because people are not going to the examinations for whatever reasons. And so the early detection is not happening. But we're asking everyone to get the word out that if you don't do it for yourself, do it for your family or your loved ones, because early detection is what will save your life. I know that here another one is prostate cancer for men. We don't really emphasize that the same way we do for breast cancer as well. And, men and women can get breast cancer, but only men can get prostate cancer. So what I'm saying here is that we had, for the last 4 or 5 years, launched a program to say early detection will save your life, may save your life. And we have seen a lot of men come forward because of that outreach, community outreach. I heard that mentioned, and speaking with our healthcare facilities to emphasize and their programs and to really encourage them to do greater community outreach, so forth and so on. But we're finding out that a lot of the men still hate to go get their prostate checked. So we're telling them that it only takes a blood test. Your PSA can give you an indication of where your measurements may be. If it's accelerated, yeah, you may have to go through the physical check. But the point is, it can save your life. So colorectal cancer and prostate cancer, early detection, are two very important issues that need to take place in our community. Now, last thing I'll say is that we know there's been changes in Medicare and Medicaid, and some people who were able to use Medicaid, even through my office, was able to get uh, quick services through our community because they were on the Medicaid rolls. They may not no longer qualify for Medicaid. So now they are pretty much um, going without, or either I'm referring them to the Department of Veteran Affairs Healthcare Program and encouraging every veteran to register themselves in VA healthcare as well as their spouse if they're married. Many don't know they can do that, but that's the purpose of this meeting, to let you know that when veterans register for VA healthcare, which they should do, they should also register their spouse, because then they would be able to get the care that they need without worrying about, do I have insurance? Do I am I no longer receiving Medicaid for my post-traumatic stress disorder or things of that nature? So those are some of the things that we are speaking about here in the Veteran Affairs Office. And for those that don't know me, I'm the Veteran Affairs Office Manager here in Prince George's County. And we're very concerned with our outreach. We're very concerned with our aging population, as we're right now, we're looking for the assisted living facilities. We're seeing an increased calls for geriatrics and assisted living facilities across the region. Many families want to have their loved ones near them. And so we're putting a list together that shows that, from a geographical perspective, where uh, uh, the assisted living facilities are in the healthcare and the rehab facilities are, because we're aging. And I'm a Vietnam veteran myself, so that pretty much tells you that I got a little age on me. But at the same time, I have those are my age groups and younger, looking for assisted living facilities, in-home care facilities, and things of that nature. So those are things that's on our radar screen that we work every day. And I'll just say this: if anyone would like to reach out to us, I'll put my information in the chat. Thank you.
Please do. Thank you. And thank you for your input. Yeah, I think some things that you mentioned that really stuck out to me is just saying, how simple a screening can be. It doesn't have to be something to be scared of. Making sure that there's shared consistent language across organizations. I think that that's helpful, that it's not just one organization talking about, getting screened for colorectal cancer, for example, but that it's all of us, not just in this coalition, but partners outside of the coalition as well, talking about the importance of these screenings and early detection and how beneficial they can be. And letting people know about, yes, there are changes in Medicare, Medicaid, but here's an alternative route to seeking the care that you need, and simplifying that, because it from what I've heard from community members, well, my Medicaid ran out, and I don't know what to do, and I don't know where to go, and I'm tired and I'm frustrated. And yes, you can be all of those things and you can still take care of your health. So just making sure that we're empathizing with the community. Some of us might be experiencing that ourselves, but just empathizing with the community and being able to share the resources that do exist. It doesn't have to be hard, but if you also need help navigating that, let me work with you or connect you to somebody who might be able to assist you in navigating some of these systems and changes in care. So I love that feedback. Thank you, Dr. Dula, for that. We appreciate you.
My
And
pleasure.
thank you for your information as well. Joyce, another theme, improve access to care. Yeah. Access to care, expanded outreach. I love it. Navigation support, coordination across organizations, across partners.
And it's not really a common thing, but honestly, just to, I guess, second with it's Dr. Dula, correct? Yes. But
Correct.
what
Yes.
he,
Uh-huh.
yes,
Yep.
what he had said about the PSAs, there were men in my family who were actually afraid of getting checked, right? Obviously because of what they hear and whatnot. But once I had actually learned that there's a blood test before that lets you know that if you actually even need that physical screening or whatnot, I told them about that and was actually able to get some folks in to get some care that they needed off of that blood test. So although they were scared, you know what I'm saying, about the physical aspect, I learned about that and I was able to share that with them. So really it is about that getting that information out to folks. I really just feel like folks may not know. And so the back in the day was, oh, you go to the doctor X, Y, and Z. Folks are scared of that, but there are preemptive measures before you even have to get to that point if you have to. So I definitely think just getting that information out is always going to be conducive.
And you're absolutely right. No one wants to go into a man, especially and
Mhm.
hear that glove slap on the wrist, because that is not a pleasant sound. And that's what's that's what scares a lot of men away, because they hear this horror story. And you're exactly right. They don't know about the PSA. And I heard you say something about collaborating across all spectrums, and that's what this office is built off of, partnerships, because we share our information across the entire region, and sometimes the nation, because people call us, and especially Vietnam veterans, those that served in Korea during and along the DMZ, those that served in Vietnam, like myself. Uh, there were chemicals used on us that was not really understood for many years. But once they understood the chemicals were killing us, then they found out, they came up with a presumptive conditions list. And for those that served in, like I said, Korea or Thailand or Vietnam during the Vietnam era, uh, that's a very extensive list. But one of the causes of the Agent Orange is prostate cancer. And just about all of us Vietnam veterans have had or are dealing with prostate cancer. And there's various, let them know there's various treatments too, if you catch it early. It's not, the first thing they told me when I was diagnosed, they said, Dr. Doolittle, at Walter Reed, because I served 30 years in the Air Force, they said, it's not a death sentence. So we need to get the word out that if you catch it early enough, these cancers are not a death sentence. Colorectal cancer, prostate cancer, breast cancer. And that's what people are afraid of. I get calls from the wives, from the husbands, across the board. I call up and the wives call and say, my husband is suffering something going on wrong with him mentally or whatever. And we talk about it, but they won't go get diagnosed, got checked out, although it's free at VA. And come to find out, they've had PTSD ever since they came back from the war, just like me. But nobody really paid it attention. So post-traumatic stress disorder is a big deal. And marriages have broke up because of it. People have been injured, incarcerated, the whole 9 yards. But now we know that post-traumatic stress disorder and military go hand in hand. So that's another health issue that we might mention, because I did mention Medicaid. I used to be, I could get a call from a veteran, says, Doc, I got PTSD, I do believe, but I need a big diagnosis. I send him to a civilian doctor to get diagnosed. They sign him up for Medicaid. He goes right through the process. But now they lost their Medicaid benefits, so I tell them to go to the Department of Veteran Affairs Healthcare. So there's just a lot of things that go hand in hand with this committee, because I think it's so important that we talk about it, that we brainstorm, and that we benchmark, because all of these things affect all of us across the board. If it doesn't affect you, it's going to affect your family member. And so I put my information in the chat. I can get long-winded because I'm really big when it comes to healthcare. So don't hesitate to call me if you need to or just want to chat about it. Thank you.
Thank you, Dr. Doolin. Thank you, AJ, for your contribution as well. And to that point, Jessica has a comment. Thank you, AJ, and that emphasizes the importance of fostering trust across all communities. So I think that's so important. I think that's so important. So thank you all for your contribution there. And so, yeah, so when we think about some of these common themes, so community engagement, earlier detection, we have improving access to care, intentional coordination efforts. When we think about some of those themes, let's try to use that to draft our goals. So we don't need perfect language right now. It's just about drafting, and we can clean it up after the meeting, but let's use this goal setting formula with our green post-its over here to the right. And we'll use this formula kind of as a guide. So we want to either increase, improve, or reduce what, for who, by how much, or in what way. And I'm leaving the time frame piece out because we know we have 3 years to achieve this, and we can figure out more specific time frame when we get into our strategy development. But just for now, as we're drafting some initial goals, again, we don't need perfect language. Let's consider some of these themes. And I have a couple examples at the bottom here, just to kind of help formulate our thinking. But if we're thinking about something like preventive care utilization, an example goal might be improve access to and participation in local preventive screenings and annual wellness visits for Prince George's County adults by increasing community-based screening events and targeted promotion efforts, right? So if we wanted to go out in the community and help promote colorectal screenings or prostate screenings, to share some of that information that Dr. Dula was sharing with us, some of that language, that shared language, that could potentially, we could draft a goal around that. If there's a goal specific to healthy food access, an example goal for that might be increasing awareness and access, access to culturally appropriate, accessible, affordable, and nutritious food resources for residents by expanding promotion and utilization of a food resource map, right? So something like that might exist. So just some examples to kind of get us started, but opening the floor for some initial drafting ideas. Hi, Anya.
Good afternoon, everybody. Sorry I joined a little bit late, but I would like to approach this from the healthcare infrastructure perspective.
Hey,
So
Dr.
as
Dula.
I'm sure that most of you are aware that Prince George's County has a significant of deficit of primary care providers, right? So when we talk about access, we have limitations in terms of accessing, right? But we also have a fundamental issue with actual lack of providers. So I would say increase the number of primary care providers in Prince George's County. Would have to do some additional research to figure out, like what numbers we want to put in place. And I would suggest, and actually we need to follow up with the health department to see how is it going, working with Health Resources and Services Administration with HRSA on identifying Maryland's health professional shortage areas as well as service delivery areas, because I know they told me last time I checked that they'll be reaching out to the health department to basically begin their new designation testing in January of 2026. So basically, like it'll be good to have HRSA's input on what how they define deficit in Prince George's County. But anyway, so increase the number of primary care providers. Thank you.
I love that. Thank you, Anya. And yes, keep us posted. I haven't seen anything about the testing going out, but if you hear anything, I'd be interested in learning more about that, especially how they define what that deficit is in the county. We have a couple of comments. Priscilla, she loved your idea, Anya, especially ones that deal primarily with debilitating chronic conditions. Dr. Dula, thank you, AJ. More young men between 40 and 70 should be made aware, excuse me, that the PSA can save their life. Let's spread the message, nothing to fear, but everything to gain, life. I love that. And Joyce, potential goal here is to improve coordination between clinics, hospitals, and community partners for PGC residents by implementing a shared referral and communication pathway. I love that. That's another great idea. And interestingly, Joyce, we had two other work groups that utilized this concept as one of their goals, and wanted to look into that shared referral and communication pathway. And so that, since it was mentioned in those other two work groups, there might be some overlap and some coordination possibilities in the future with them and with this work group. And one of the platforms that they used was Find Help. And I'm just kind of opening the floor to the group, but is anyone here either familiar with Find Help or currently using Find Help to make referrals to services, to search for resources in the community by chance?
I'm not
No, can you
familiar,
please put
but
that information in the chat?
Yes, I can do that. Priscilla, never heard of it. No. Okay.
and I'm also like, I'm not familiar with this particular resource, but I love that point. I think that we as a county can improve the way we're utilizing some of the already available tools, such as 211 and 311 and potentially others to empower Prince George's County residents to better, like navigate some of the services that are available. So I think that there are some tools that are already there, but the question is to what extent we're utilizing them. So I would say, so find help as well as other, right, like existing tools to assist with care and navigation.
Absolutely. Thank you. Yes, and 201 was the other one that was mentioned as well across work groups. So, yes, I will share. AJ, I don't know if you have a moment to kind of like add the website to the chat. If you have a moment, if not, I can send a follow-up after the meeting as well. Jessica poses a question. Do we know how many clinics in the county are currently utilizing Find Help? I do not know that answer.
I'm just saying that because like I know I'm familiar with Find Help too, but it's just, a tool like that is great, but it's only as great as people utilize it, right? So clinics have to
Absolutely.
utilize it, community partners have to utilize it. That's a great feedback referral system. So obviously if someone's
Yes.
going into like a YMCA or somebody's going into one of those community-based organizations that they are a member or they're comfortable in, that is a great, working with the, being with the American Heart Association, we find out that's a great way to get community members engaged, especially ones that maybe have not seen a primary care provider in a long time, or, you know, coming up, blood pressure, right? We're talking about the silent killer. A lot of people are walking around with either undiagnosed hypertension or they're not taking their meds. But again, like how does, we have to see like who's using it, how is it, how are they using it? And like just the, what is the capacity, just to see kind of like what is in percentage wise, like how many clinics, especially the clinics, free clinics, our federally qualified health centers and things like that, Greater Baden, are they utilizing it, but it would be helpful to know that because again, a tool is only as useful as people that are using it, right?
Absolutely.
Yeah.
Yeah, I do agree with that. And I can speak to Howard County specifically. Find Help was a relatively new concept for the county a few years back, and they did make a push to kind of campaign for partners to utilize it. And they had a staff person there. Their sole position was to go out and meet with partners and to teach them how to utilize Find Help, how to add themselves as a resource, how to share referrals across partners. And so over time, it grew to be, more accessible, much more useful, and even community members can use it to search for resources. So, excuse me, definitely, to your point, a great tool, but one that has to be utilized to be successful. So, something we can consider. As I mentioned, some of the other work groups had mentioned it as well. Joyce, I see your hand, virtual hand.
Are there are there any representatives from Find Help in a part of any of the work groups? I mean, it would be nice to have their input of how they're collecting or at least getting in contact with community partners and leaders so that they could get more information.
Yeah, absolutely. So I don't know if anyone is actively in the coalition, but I can reach out to a Find Help representative to come and speak to you all to share a little bit more information. I can reach out to my contact at Howard County to share how they've expanded their outreach with Find Help. So there's definitely ways that we can learn more. Any other thoughts on potential goals?
I was just wondering if the group may be interested in coming up with specific goals related to specific vulnerable populations of the county, such as, for example, our uninsured population. Prince George's County is home to the largest proportion of uninsured residents in the whole state of Maryland. So just wanted to bring that up to see if you guys may want to set specific benchmark for some of those targeted populations. Thank you.
Yeah, I definitely think that's something we should consider. We do want to keep equity in mind. So considering other populations that might experience difficulties accessing care, accessing resources. So whether that's the uninsured, if we're thinking about people living with disabilities.
Miss Vicks, this is Dr. Dula. did I hear correctly that Prince George's is has more uninsured people than anywhere else in the state of Maryland?
Good afternoon, Dr. Dula. I would love to
Hi.
connect. I would love to
Yeah.
connect with you. So,
Oh
based
yeah.
on some of the recent statistics, when it comes to non-elderly population, Prince George's County has basically like 14% of our population is uninsured, which is the highest rate in the state.
Wow.
Furthermore, we are home as a county to 27% of all uninsured Marylanders. So Prince George's County does have a disproportionately high,
Mm.
like ratio and number of of uninsured residents, which is why like obviously work of federally qualified healthcare centers is absolutely critical, right? Because they're the ones who accept everybody, including those who are uninsured.
That is impressive. I knew that there was a large number of people in our county without that are uninsured because I deal with them every day, but I did not know that statistic. And that raises a question. If we have such a large population who are uninsured, what can we do to get the word out, to find out how we alert them to possible health care and how to pay for it, that type of thing?
I'll be more than
Yeah,
happy to talk about that with you. We
yeah,
actually do have a work group that's currently
okay,
underway that you may want to participate, and that's like that's separate. I mean, health department representatives are involved, but it's a completely different
yeah,
group. So, but it's targeted specifically to providing healthcare to our uninsured. And of course, as you have mentioned before, we are expecting to see a significant surge in this population with changes at the federal level. So yes, absolutely. And then in
yeah,
terms of, I love your point in terms of how do we engage our community. So because obviously we as county government have to be even more strategic with all the non-monetary resources that we
yeah,
have, right? So once again,
yeah,
even if it's outreach, so successfully utilizing our partners such as Department of Park and Planning and their facilities, engaging perhaps our library system, also seeing how we can be like a better partner to our school system, right? Because I don't know if you
yeah.
know, but our school-based wellness centers have not been operational for several years,
Really?
you know so
Huh.
they're just beginning to reopen them. A couple of them I think are being reopened as we speak, which is absolutely great, like great news. But yes, there are some, I mean, we cannot resolve all these issues single-handedly, but
Uh-huh,
by
uh-huh.
working together, I think we can achieve much better results.
I didn't know that many of the school-based wellness centers were not operational. When I was Health and Human Services DCAO, I opened those up
They
back in the
they were all
early 2000s. Yeah, I think the
they
one in Oxon Hill still might be there. I remember.
they
I
were
don't
they
know.
were all shut down when
All
the
shut down.
responsibility got transferred from the health
Hmm.
department to the school system. But I'll be
Okay.
more than happy to speak to
Yeah,
you
yeah. I look forward
offline.
to it. Thank you.
And Anya, if you can share, if you're looking for more participation in that work group, if you want to share the details with me, and I'm happy to share that as a follow-up to our meeting as well for anyone else who might be interested.
Thank you so much. Fantastic.
Sure. And then I'll read this last comment. Jessica says, partnering with FQHCs may be helpful in reaching the uninsured population. Not all of their patients are insured, but a large percentage is. Thank you for that comment. And so I do want to be respectful of time. We have 6 minutes. But thank you all for contributing. If you have additional thoughts or additional goals in mind, feel free to just send me an email so we can include that as well. We don't want to miss anybody's thoughts at all. And so again, what we'll do is we'll take this, we'll kind of clean up the language a bit, and then share that back with you all next month so we can determine how we want to prioritize our goals and objectives moving forward. So great conversation, great opportunities to share across partnerships. I love this. Jessica Moyes, her comment says it would be great to get the library system engaged with our coalition and other areas. We have blood pressure loaner programs there. Love that. Yeah, so I think there's a lot of opportunity for all of us to engage our partners a bit more. So this is great. And on that note, I'm going to go ahead and turn it over to AJ to quickly share our community announcements.
Thank you, Shanae. Thank you, everyone, for joining us today. So, I'll quickly go through our announcements, starting off with our PG area plan listening session. The county's been prepping for their FY26 area plan listening sessions. There's one session remaining where you can join either in person or virtually, and that final session will actually be in about 5 minutes. So, if you would like that information or you'd like to join that, please feel free. Next up, we have a funding opportunity. The Maryland Department of Health is offering two new funding opportunities. The first is from the Office of Minority Health and Health Disparities SDOH program. This program provides funding to organizations to provide community-based interventions targeting the upstream factors that impact health, typically outside healthcare delivery, necessary to reduce health disparities and maintain healthy communities and populations. You can learn more about the program and funding opportunity using the links provided in the slide, and we'll make sure that this is shared with you after the meeting. The second funding opportunity is from the Minority Outreach and Technical Assistance, or MOTA program, which focuses on community-based health education and prevention through funding to organizations to support projects targeting chronic disease and critical health areas. Again, you can learn more about the program and funding opportunity using the links. Application deadline for both grants is March 11th by 5 p.m. Next up, we have the MedStar 2026 Health and Resource Fair at Clinton Baptist Church. It'll be a day filled with educational resources and support for the Prince George's County community and residents. Please save this date, Saturday, March 14th, from 10 a.m. to 1 p.m. If you would like to attend as a vendor, there is a vendor sign-up form hyperlink on this slide. Next up, we have I and Me Grief Support Group. It'll be hosting a 10-week grief support group for Black men coping with grief. This group will be led by grief clinicians and will meet on Wednesday starting March 18th through May 20th from 7 to 8:30 p.m. You can visit iandme.com to schedule your free consultation. This is also listed on the PG Hack Health Zone our calendar of events. Next up, we have the University of Maryland Capital Region hosting their chronic disease self-management program classes. So this program is designed to empower individuals living with chronic diseases by providing them with the tools and resources needed to manage their health more effectively. This workshop is convened in person for 2.5 hours each week over the course of 7 weeks, starting Tuesday, March 24th. You can visit their website for more info. Next up, we have the Maryland Wellness Swell Conference. Maryland Wellness is sharing information about the upcoming Swell Conference. This is a multi-day professional learning and wellness experience offering engaging presentations and panel discussion. Practical tools you can use in a professional setting and a retreat-style setting that supports learning without burnout. This event takes place April 16th through the 18th in Ocean City, Maryland, and you can visit their website for more information. The GOAT Youth Mental Health Expo. Join the GOAT Expo team on Saturday, May 10th at Bowie State University for a full day of workshops, resources, live performances, and support for youth age 16 to 25 and their families. The event is free and you can register via the link on the slide. Two more here. Camp Nabi is a youth grief camp. It'll be a full weekend overnight camp for youth 6 to 18 years who have experienced the death of a loved one. This is hosted through the Chesapeake Life Center, and you can reach out to our fellow coalition member, Carrie, for more information. And then last but not least, we have our All Cancer Support Group. Hope Connections in the University of MD Capital Region are hosting a virtual All Cancer Support Group on Wednesdays from 12 to 1 p.m. This is also on our calendar of events on our website. You can register to attend, to connect with others, feel supported, and gain additional information and resources to support your journey. And I know we have only 1 minute left, but I do want to give a chance for anyone if you have any partner announcements. But if not, turn it back over to you, Shanae.
Okay. Hearing none, if anyone has anything to share with the group after, you can send that email to me and I'll make sure it's included in the follow-up tomorrow. If you haven't already done so, Please scan this QR code to update your coalition contact information. We'll also use this to gather credit for those who helped participate in the CHIP development process. We will make sure we include all of our partners and have them listed in the document as well. So this will help us keep track of everything and everyone who's contributing. And then just a quick snapshot of the upcoming work group meetings for this next quarter. I highlighted our next Healthy Living work group meeting will be Wednesday, April 1st, same time, same place. And we have our March quarterly meeting coming up next Tuesday at 6 p.m. It will be virtual. The registration link is on the slide. AJ, if you don't mind dropping that in the chat, but I'll also make sure you get access to that link post-meeting as well. But we encourage everyone to attend. We're going to hear from all of the work groups to hear what they've been doing with their goal setting, with their problem statements, root cause, like all of the stuff, all of the things we've been doing. You're going to hear from everyone else. So it'll be a great opportunity to hear where we could potentially overlap or collaborate with some of the other work groups as well. And on that note, thank you, as always, for your insight, your partnership, your contributions. We appreciate you all being here and look forward to continuing this work together. Thank you so much. Have a great afternoon, everyone.
Have a good one, y'all.
Bye-bye.